Dr. Leisle, I've heard that some parents, that sometimes children bite their lips. Maybe actually they bite their lips after they get dental work done. What's happening there?
A common problem. Well, what happens is it's usually the lower lip where they do it. The upper lip, not. But the lower lip, when they get anesthetic on the bottom, sometimes if one side of the face is done, like say 3-4 fillings and one side are done, or a crown or two or a nerve treatment, they're going to have what we call a mandibular block injection. Basically all that means is the lip is numb, half the lip is numb on the bottom, and the half the tongue is numb. So a child can bite their tongue later after treatment, or bite their lip within that 45 minutes, 2 hours after treatment's been done. So what we do in our office, obviously, is give them a cotton roll, something put between their teeth rather than a tongue or lip. But not always does the child leave that in there. So we give them a couple of them in a little envelope. And then not always does the parent put it back in the mouth when they fall out, or they throw it out, or they kick it out. So what happens is they chomp on their lip because they think it's a little piece of rubber, and they're going to chew. And as you know, some children get kind of fixated on things, and they're going to work that lip over. And then the next day, the parent is wondering why their lip is all swollen or has this big white, ugly-looking lesion on it. And what's come from is obviously just trauma. Nothing is to be done. Some parents want to give them a pill, or they want to come back in. What do I do with that lip? And that lip's going to look like that probably for about 4 to 5 days, because depending on how much chewing the child has done. And so nothing can be really done about that. And you just keep it nice and clean, you know. You don't have, I don't know if you've ever bit your lip, Helmut, but if you bite it once, you tend to bite it again. And so then you got this, it's kind of like having a swollen thumb, you know. You hit your thumb and then you touch and everything, it hurts. So they have to be careful, you know, for the next few days.
Not so sure I bit my lip, but I did bit my cheeks, you know. Oh my God, that hurts. And then yes, you bite it again and again and again. By the way, you gave a good explanation why biting the lip is happening. At least with children and after dental work, you know, anything about biting the cheeks? Why is it sometimes so heavy in the way of the teeth and otherwise not?
Well, it depends on a child. Cheek biting or sometimes lip biting, I'll show you like this. They suck their lower lip, okay? Their oral habits. A lot of times, cheek biting, I mean, obviously you can have an accident where you bit your cheek and then you bite it again because, you know, then it's just sticking out there and you nail it. But lip biting, lip sucking, and do you still have there we go. Lip sucking or lip biting and biting a cheek, they're oral habits a lot of times. And usually there's a transient. They only last for maybe 4 months, 6 months, a year. And usually it's a child going through some stressful time at school, family life, a combination of challenges. And so when that happens, a parent needs to look not so much what they're doing, but why they're doing it. You know, what's the reason for causing that? Maybe they're being picked on at the school and the playground. So those are good things. I mean, the physical manifestation, you know, it can be dealt with. Like lip sucking, that won't. You get a little bruise, you get a line across the lip, and that won't go away until after they're done sucking on that lip, you know, months later. But let's find out why they're doing it.
Right.
Okay, that's the most important thing.
Okay. Wow, interesting little topics here about dentistry. It's quite amazing. I'm sure very.
Kids are fun.
They
are amazing.
Yeah. You know, we're good, miraculous creatures, aren't we? Huh?
Yeah, made by the miracle maker.
Yeah, we know. We surely know how to create problems for ourselves, don't we?
We do at times.
Yeah.